23 and I'm a sufferer of endometriosis.
What is endometriosis to you?
Endometriosis is like a cancer or a disease. It is benign, which means it doesn't, it's not supposed to be life-threatening, but it's it's a weed that grows within you and onto all your organs.
What is your journey so far?
Well, so far, I first found out that I had endometriosis when I was 14, as well as polycystic ovaries. I was put on the pill at that age to try and stem the flow of the growth, which did seem to work for quite a few years before I had my first child at 28. So for 14 years it kept it at bay. When I had my first child, it seemed to go away a little bit, and then it really took off when I had my second child. The hormones caused it to grow even faster than it had before before the first child, and since then it's been labelled as being a grade 5 endometrial cancer. My journey after that has been back in 2002 I had laparoscopy, well actually 2 of them in that year. In 2003 I had a hysterectomy or partial hysterectomy where they left my left ovary. Then I had another laparoscopy after that just to clean the endometriosis out. Then in 2005 I had another operation, open operation. Then in 2007 I had another laparoscopy. 2009 I had another open operation. 2011 I had another open operation, and then again this year, just last week, I had another operation, but this time to remove my ovary, my last remaining ovary.
Will it ever come back after this final operation?
I've been told that it shouldn't come back. I will have to wait and see when I have my doctor's appointment in 3 weeks' time to see whether the hormones have slowed down, and also what sort of treatment they're going to put me on, whether it'll be a pill or hormone replacement. And once they put me on that, hopefully it will never come back.
Have there been any weird or interesting stories that have ever happened in your journey?
Well, the weird stories have been to me that I keep getting told it won't come back, but it keeps coming back. Interesting stories that I've been told by other people is, where it's actually really impacted and it's gone and grown on everything, and I've heard of deaths through endometriosis. So, where it's actually grown into, some of the large organs and killed women. So I'm very lucky that that hasn't happened to me.
How has this impacted on your life?
It's not only just impacted my own life. Work has been fantastic. With all the holidays I've been able to have, well, not holidays I should say, but all the sick leave that I've been able to have. They've always been very supportive. Now, it only just doesn't impact your own life, it impacts your family. It impacts, it's impacted my husband and my children over the years, which they've been fantastic as well. But it does, because you're out of action for, more than, it can be 6 to 8 weeks, and physically and mentally it affects your head. Just last year I had, my head was really, really bad. I got anxiety, a bit depression, all that sort of stuff came along with it. So, and I shut a lot of people out. It was the first time it had impacted me that way. So it's not just the, the physical, but also the mental impact on your life.
When you had the first operation, or when you even heard of you having this cancer, what was the thoughts going through your head?
All right. The first operation, after I found out the second time really, because when I found out when I was younger, I was very young and didn't understand what was being told to me, but just lived with it. But when I found out that I had it after having James, that just it does mess with your head a lot. You feel like you're what do you call it? Why me? You do the why me thing. Why did I get this? What did I do to deserve this? But in the end, you sort of learn that it's part of being a woman. Some women get it, some women don't. Some people get other things like cancer, and so it is part of being a woman. We all get these things happening. So in the end, it was a shock, but you learn to live with it.
You've been seeing the scientists and the doctors and all that. What are their names? So, like, what are they called?
Okay, well, my first doctor, Dr. Daniels, that was the one that I saw in the first place. She was just a normal GP, so she referred me to the Royal Women's Hospital. The gynaecologist that I currently have, which is Andrew Newk, he was actually at the Women's Hospital, back when I first had my first operations, and then then after Dr. Daniels, I moved to another GP called Lindsay Kabat, and then she's really looked after me. Then she referred me to the Northern Hospital, where I found that Andrew Nook was actually now working at the Northern Hospital after the Royal Women's Hospital disbanded. So he's been a really good gynaecologist, and also I've just had general surgeons at the Northern since then. So
you have gone through so many ultrasounds through this cancer, and since you've found out, how do they work?
When your doctor normally does a physical examination, and they feel your stomach and feel the cyst, and then they'll refer you to have an ultrasound. The ultrasound consists of both an external, like when they're looking at a baby, they put the gel on your stomach and then look for the endometriosis that way. The second way is to actually have an internal ultrasound, which is where they get it's like a stick, a long stick, and they insert that and have a look internally. It can be quite uncomfortable, when they're doing it, but it is a more effective way of working out the size and the dimensions of the actual cyst and how big they are. They can also do scans such as CAT scans and things like that, but I've never actually gone that far as to have a CAT scan or a scan at all. But they have been known to do that just to work out the extent if it's grown anywhere else.
There is approximately 10% of women that have any endometrium cancers. Do you know of any?
I only know of one other person that's actually had endometriosis, and that's my sister Melanie. She actually had her right ovary removed at a very young age. She was about 18 when she had that removed with her appendix. So that's the only woman that I've actually known that has had endometriosis. Even at work, there's been none, directly at work. I've only met women through what I've gone through, that have actually had it and have been able to cope with it. And that's one way of coping with it as well, because I've had, back up from them to talk to them about how, how to cope with it best and to get over it.
What are the symptoms before and after? So before your operation and after your operation.
The first time after I had my second child, James, that was what I found was I started to spot between my menstrual cycle. So, when I was ovulating, I would bleed, and then later, as it progressed, I ended up having my menstrual cycle for up to 3 weeks. I was clotting, and it was quite severe. Some women don't get that, but that's what happened to me before I had my major operation. That's why they went in and did the laparoscopy twice to try and stem that before they did the major operation.
So what's after? So what's the pains that you have after? Like right now, how do you feel?
It's more just, obviously the scar knitting, not being able to stand up straight, not being able to do all that sort of stuff. And it's more it can vary. It can be just a slight ache, and sometimes you can get up and you feel like somebody's kicked you in the gut, literally. It's very differing pain. But the knitting is the worst part because it's continuous and all you can feel. It feels like somebody's in there, sewing you up. So, yeah.
With genetics, so your sister had it?
Yes.
Melanie?
Yep.
And is anyone else in your family had it?
Not that I know of. My mum never had any sort of problems with cysts. My mum, so she was pretty good. My eldest sister has had cysts, but not endometriosis. So that's Stephanie.
Okay. So you haven't had any other conditions other than that in the family, in any immediate family members?
No.
So with the endometriosis, how does it work? So how does it start in the first place?
It's to do what it is it's scar tissue. So from when I had my when I was younger, it was just believed that they're not sure what happened there because I never had any operations when I was younger. But when I had my first cesarean, that obviously caused scarring. Then when I had my second cesarean, obviously more scarring came, and with the hormonal change in that, actually then caused the scarring to start growing. It has a blood source, and so it actually caused that to grow all over my body, and as long as it's got a blood source, it will keep growing.
When you've had the cancer, have you done any CT scans?
No, no CT scans.
Have you heard of anyone else doing CT scans?
I have heard of that being used as a course of finding where the actual, where it actually is, because if it's grown up in other places, like joined to the base of your stomach, things like that, they will normally, do a CT scan just to work out where it is before they do the operation.
Yeah, because in the information there is a lot of different things that you can get. So you've talked about the laparoscopy and those kind of things that actually go into your stomach, keyhole surgery.
Yes. Yep.
And is there any other X-rays that you can get to try to find out other than the ultrasound?
I've never actually had anything else, but I'm sure there would be. I'm sure that they would be able to do an X-ray, because it's like looking into your body, the same. So it's like a CT scan, things like that. They'd be able to use those sort of methods to look as well. But I've only ever had ultrasounds.
What equipment and technology has been used in your case?
Okay. Well, obviously ultrasound. So the ultrasound machine, as I said, there's like the external and internal ultrasound. I've had laparoscopy, so obviously, keyhole surgery where they've actually put, the camera in and taken the endometriosis out that way. I've also had open operation, so obviously scalpel, cut me open, then suck it out. So taking the actual scarring off the various organs. So over the years, I've had multiple ones of those. But that's about it really.
Have they ever tried to measure it? When they take it out, what do they do with the cyst? Do they measure it, or do they weigh it? Do they do any kind of measurements?
Yes, they do. They measure the size of the cyst normally at the ultrasound, and then each time they've been able to tell me what they've actually, the size of them, and also the weight of them, at each surgery. So last year I had two 1 kilo, roughly 1 kilo cysts, and also smaller cysts. This year they told me it was about the size of a sort of small grapefruit, large orange, and so looking at that might be about 1 kilo in weight.
With your cancer, have you ever told the story of your cancer? Have you ever tried to get it out?
Yeah, back when I had my big operation, the hysterectomy, I actually had an interview with at work. We have a thing called NAB TV, and they came and interviewed me about what I'd had, and also because I'd used our what we call sick leave registry. I've also started to put down some details of what's happened with me. I've named it Me and Endometriosis, and I'm going to soon, once all this is all over, hopefully, I will send that off to That's Life and a few other magazines to get it published.
Do you have any final words?
Well, all I can say is that, to all you girls out there, that, if you ever feel any sort of really bad pain, you're not sure what it is, and, like me, if you feel like, there's something wrong, always go and get it checked out. Never just leave it, because if you leave it, it can get really bad, and it can actually be life-threatening. So, I just implore all of you girls to go out and do that. Thank you.
Thank you for watching.